Thank you for joining us for this month's webinar. Our topic is exposure. How did that happen? And our presenter is Jessica Reynolds, who is an RN and a health coach with Strategic Health Services. Jessica?
Hi, Dawn. Thank you so much. My name is Jessica. I'm a registered nurse for 25 years. I pride myself in two areas as a nurse. One, being proficient in my clinical skills. Two, education, my knowledge base and ability to research and teach. I'm thankful for the opportunity as being a health coach, as education is so important to me. It's part of our mission as health coaches for Strategic Health Services to provide our members with support, tools, trackers, as well as educational opportunities that we can provide. So again, thank you guys for joining us today. We're going to talk about exposures. I mean, really, how did that happen, especially in light that this is summertime, and a lot of us prepare our foods differently in the summer than we do normally in the kitchen on a daily basis. So again, exposure and how did we get exposed to that? Some of the things we're going to be touching on today are Listeria, E-Coli, botulism, Salmonella, and I just thought I'd add measles just because it is a disease. We'll start with Listeria. The definition, according to the CDC, Listeria is a serious infection caused by eating foods contaminated by the bacterium Listeria monocytogenes. The disease primarily affects older adults, pregnant women, newborns, and adults with somewhat a weakened immune system. Your risk may be reduced by the recommendations for safe food preparation, consumption, and storage. Food prep, the FDA recommends some guidelines for prevention. You have to rinse your raw produce, which means fruits and vegetables. And you really have to rinse them thoroughly, and you do this before you slice them open and just thoroughly under running tap water. For firm produce, like cucumbers and melons, which actually are a large source of Listeria, you'll need to scrub with a produce brush, then dry with a paper towel. Then, of course, you have to wash and dry your hands with soap and water for 20 seconds. You need to separate your uncooked meats from your ready-to-eat foods. Keep your kitchen counters clean, including your cutting board. And again, FYI, Listeria can still grow in the refrigerator. You need to set your refrigerator temperature to less than 40 degrees, and your freezer temperature needs to be less than 0. As for consumption, you have to cook your meats thoroughly to the recommended temperatures. Pork, poultry, and sorry for you rare beef eaters, this too has to be cooked completely. As for storage, use any pre-cooked, ready-to-eat food as soon as possible. Follow the USDA guidelines for refrigeration storage. Again, it's 1 week if it's opened, 2 weeks if it's unopened. If indicated, you may go ahead and freeze these prepared meats. Freeze immediately. Keep in mind, freezing will keep food safe. However, freezing does not kill bacteria. Only heat will do this. As for luncheon meats, if it's factory sealed, it's good in the fridge for 2 weeks. Once it's opened, which includes those deli counter meats, they have to be used within 3 to 5 days. So if you're going to store those in your refrigerator, you've got to cover them in airtight containers. Also, do not use unpasteurized milk. This includes cheeses. Check your label. Make sure your label says made with pasteurized milk. And again, back to cooking food, meat more specifically. The temperature to kill bacteria in meat is 160 degrees for ground beef with no rest time. Rest time is that certain amount of time that you rest your food after removing it from the oven or the grill. when the food temperature remains constant or continues to rise for a specified amount of time. For instance, steaks need to be cooked to 145 degrees with a rest time of about 3 minutes. All poultry should be cooked to 165 degrees with no rest time. In addition, with storage, all meat, say if you're at a barbecue, all meat should be refrigerated within 2 hours. If the outside temperature is greater than 90, it must be refrigerated in under 1 hour. Listeria symptoms. Symptoms, fever, muscle aches, sometimes some diarrhea, headache, confusion, loss of balance. If you feel like you have any suspicious symptoms, you'll need to report those to your primary care physician. And again, important to know about Listeria. Listeria is killed by cooking to proper temperatures and pasteurization. Also important to know that you can have symptoms of Listeria up to 2 months after your exposure. So again, if indeed your blood or spinal fluid does come back positive for Listeria, the treatment for that is antibiotics. Next, we'll move on to E. coli. E. coli is just another bacteria. It normally thrives and lives in the intestines of people and animals. The CDC does not list specific outbreak numbers in general with E. coli. There's a more serious strain of E. coli, the O157 H7. It was reported at about 80,000 folks a few years back with many serious complications, including death. The reason I bring this up is E. coli actually peaks in July, so I just thought I would mention that. But again, most strains of E. coli are harmless and are actually an important part of the healthy human intestinal tract. However, some E. coli strains can cause illness. These strains can be transmitted through contaminated water or contaminated food, or through contact with animals or persons that have already been exposed. E. coli symptoms, diarrhea, urinary tract infection, respiratory illnesses, and actually other complications. You can get symptoms 2 to 8 days after swallowing the E. coli bacteria. Most people can actually just fight this bacteria off without any intervention. In about a week, you start to feel a little bit better. However, the rest, you can be left with severe infection. Again, that same population, those older folks and children under 5 especially. Important to know about E. coli, again, it's about protection. You got to protect yourself. Wash your hands thoroughly after you use the restroom, after you change diapers. Well, not yours, but a baby's, change the diapers. And preparing and eating all your foods and touching animals. You have to keep objects that touch an infant's face, like her bottle, her pacifier, teethers. You have to clean those with soap and water and dry them with a paper towel. For your hands, if soap and water is not actually immediately available, then you can use those alcohol-based sanitizers. You actually see those everywhere, at zoos, grocery stores. And they're actually very easy to find on counters of most businesses, and those are perfectly okay. However, with those sanitizers, I need you to know that if you actually see something on your hands, then soap and water is your best option. If you're looking at your hands and see nothing, obviously you can't see germs. So the sanitizer done properly is perfectly fine. And again, the same precautions are as for Listeria. You cannot cross-contaminate your kitchen counters, your cutting boards, your knives. You have to cook all your foods thoroughly. And again, if ever in doubt, I love the foodsafety.gov guidelines for the cooking and storage temperatures. Again, you have to avoid raw milk, unpasteurized dairy, and this also includes juice. And most importantly, do not swallow lake, pool, pond water, because E. coli actually love this type of breeding environment. Also of note, when you order, say, like a hamburger from a restaurant and it comes back to you a little pink, this is undercooked. You got to return it. And when you do, you have to ask nicely. You have to ask for a new bun, a new plate, because if this piece of meat indeed was infected and you just return the burger, the unkilled E. coli bacteria is on your entire plate. Your whole plate has been contaminated. So again, return your whole plate and make sure, just ask them to cook that meat a little bit longer. Botulism, I'll just do this briefly because it is fairly rare, especially in comparison to, say, E. coli and Listeria. There are 5 main kinds of botulism, and they can all be deadly and are considered a public health emergency. And again, that's the reason I bring it up today. And there's only about 150 cases a year in the United States. So again, I'll keep this part brief. Botulism is the disease caused by the Clostridium botulinum, which can be found in the soil primarily. The bacteria and its spores like to be kind of dormant until the conditions occur that kind of support its growth and shedding of the spores. When that happens, there's this toxin that's released. And again, which causes the botulism symptoms. That's blurred vision, slurred speech, kind of a muscle weakness. All these symptoms are of muscle paralysis. And if that is untreated, it can cause respiratory paralysis. So again, important to know, most food-borne botulism is caused by home canned foods, especially with like a low acid content. This covers things like green beans, corn, asparagus. So people at home should follow strict hygiene standards and safety recommendations they're already set forth by the United States Department of Agriculture. If you should buy something that you know is home canned, best protection is to boil the food for 10 minutes. Again, botulism is destroyed by high temperatures. Also, just as of note here, have you ever heard of like do not feed honey to infants? It's because honey can contain this particular bacteria. As for treatment of botulism, you need an antitoxin to block the action of the toxin in your bloodstream. It's a good thing that this is actually kind of a rare exposure. Salmonella. Again, this is a little bit more widespread, but so unlike the botulism with about 150 new cases a year, Salmonella is something much more widespread, more like 1 million cases a year. How do I get this? Salmonella comes from animals, particularly from chickens. You have to cook your chicken to the proper temperature. Remember, pink is undercooked in all meats. Do not eat raw, undercooked eggs either. Again, prevent cross-contamination. Keep your meat separate, airtight, and keep it separate from your produce. And you have to wash your produce the same as you do with Listeria. Symptoms. Again, when you've been exposed to Salmonella, your symptoms of diarrhea, fever, abdominal cramping, they start about 12 to 72 hours after infection. The illness lasts about 4 to 7 days. Most people recover without any type of treatment. Again, those others will need antibiotics, some even hospitalization. Those people who get the diarrhea can have it for several months after infection. Important to know, people with the salmonella should not prepare food or pour water for others until all diarrhea stops. And like I said earlier, this actually can be for months. So again, in general, you have to keep your hands washed. You have to prevent cross-contamination. And another just FYI, all areas that chicken, ducks, yes, even cute little ducklings at the park can be contaminated. And this includes all their surroundings. This would be the ground, the bench. Be careful and mindful of where your children's hands are going. And on another note, turtles. Turtles are not appropriate pets for small children and should never even be present in homes with an infant. Very strong carriers of salmonella. Measles. Speaking of infants, let's just spend just a quick minute on measles. Measles are one of the most contagious infectious diseases known in humans. It's caused by the Rubeola virus. It is transmitted in the air just by breathing. And of course, coughing, sneezing. Infected individuals are contagious before they even have any symptoms. So the CDC and the WHO, the World Health Organization, they classify more than 24 diseases that can be vaccine preventable. In the USA, vaccine preventable diseases often occur as a result of not immunizing and under immunizing. Measles symptoms. In the case of measles, there's already been 166 new cases from January 1st this year to April 24th. This is reported and processed as provisional data to the CDC's National Center for Immunizations and Respiratory Diseases. This is not good news, considering in the year 2000, measles was actually declared, quote, eliminated from this country. So, symptoms: fever, rash. 30% of all measles cases have serious complications. Pneumonia, meningitis, death. So important to know, there is a vaccination. CDC investigators are actually concerned that anti-vaccination campaigns are resulting in a resurgence of measles and other vaccine-preventable diseases. That being said, I urge you as parents, grandparents, talk to your healthcare provider about your vaccination status. In conclusion, I know you've heard this in the last few minutes, but again, all information in this webinar has come from the CDC website. It's their job to track and report disease. It's our job to be aware of how exposure occurs and how to know best to prevent it if possible. You can never really keep yourself from being exposed to things, both things that we know about and things that we don't know. The important thing is to remember to take precautions when you can. Wash your hands often. Use sanitizer if soap and water is not available. You have to cook your food completely. Have a meat thermometer handy. Print the list of recommended food temps from foodsafety.gov. Have it handy for a quick reference. Stick it on your fridge. Immunize. There is a reason we've been able to eradicate certain debilitating illnesses. And again, if there's ever a concern of exposure, contact your PCP, your personal care provider. So again, with that, thank you again so much for joining us today. And again, for questions about your health, your wellness, always feel free to contact me or any of our other health coaches at Strategic Health Services. Again, thanks so much.